Yes, Adri, so it's your turn concerning this comment adapted to the fillers and the threads.
Okay, thank you, Benjamin. So I will start with my lecture. I call it thread lift versus volumized and stretch filler lift. So definitely what I mean about volumized and stretch filler lift is not like in this cartoon. After this, I will explain. But for the first slide, I would like to again express my gratitude because of our good cooperation between IMCAS and Berdosky here in Indonesia. So this is my bio statement, and this is a non-sponsored lecture. So next slide. So this is a thread lift with absorbable monofilament thread. And I took this picture from the Japanese article. They perform it with multiple absorbable monofilament threads being put on the subcutaneous plane. And then, next slide. So this is the before and after, and they recorded quite completely with immediate result 1 month until 6 months. Yes, definitely we can appreciate some result, and also they confirm in the histology. Next slide. So this is histologic study. 3 months after treatment, there is a foreign body reaction surrounding the thread, as we notice. But to my opinion, with such a small foreign body reaction, I think the result of neocollagenesis and more elastic tissue, I don't think it will have a very significant effect. So let's see for the next slide. So I perform in some of my patients for a split face. The first side, which is the right side, I introduce both the needle and the monofilament threads. And then the same needle that was first introduced with the thread, but now after I perform the right side, it's just the needle without the thread, the same exact needle. And I continue with performing on the left side, but this time it's just needle only with the same exact pattern. So the right side, I introduce the needle plus the thread, but for the left side, I use the same needle, but this time the thread is already inside the right side of the face. I used only the needle on the left side. So let's see the result. So can you tell which side is better? This is before and this is 6 months after. So to my opinion, I don't see any significant difference between the left and the right for 6 months after. Definitely, I can appreciate some results in the area which I introduce the needle and the thread, or just the needle, with some new collagen. So think subjectively that she experienced any improvement, but I cannot tell which side is better between the right and the left. So my hypothesis is that maybe just the injury of the needle that caused this effect. Not necessarily we have to put the threads inside. Next slide. So even though the patients experience some improvement, but again, like the previous speaker mentioned, that additional filler in pre-jowl and chin area is still needed. So this is pre-augmentation, and the right side is post-augmentation, as you can appreciate the result in the pre-jowl and chin area. Next slide. So what is my concept of volumized and stretch filler lift? Actually, it's not a new concept, but it is based on a concept which we study after we compare the facial skin and soft tissue of young and old Asians. As you can see here, on the left side, that's my young patient, about 20-year-old. And on the right side is my other patient, which is 60-year-old, with almost the same facial character. So you can see that actually it's about skin laxity and soft tissue volume deficient that cause this effect. So the concept, which is not new, but I name it quite interestingly, is that we volumize. When we inject filler, the primary effect is volumize. After we volumize, actually we stretch the skin. So that's the secondary effect. And what we see as tertiary effect actually is a pseudo lift. It's not a true facelift, but it's a pseudo lift. So again, volumize is the primary effect, stretch of the skin is the secondary effect, and the third one is pseudo lift of the face. Next slide. So I perform half face augmentation in this patient. Next. Okay, with this amount of filler. So what we can see, next slide. Okay, this is the lateral view. Again, this is before and after in my older patient. As you can see, she has a very quite severe skin laxity and also volume deficient. But after I inject total face from the frontal, temporal, malar, and then the lower face, the prejowl, the chin, we can appreciate the secondary effect, which is a skin stretching and also an appearance of a pseudo lift, which helps to improve the patient's aesthetics. So, next slide. That was my last slide, and again, I invite all the people in Paris to come to our meeting to see and learn a lot from us, the Asian doctors. Thank you, Benjamin.